Attack of sore throat. Rheumatic fever follows the attack of sore throat. So it is not the bacterial infection. Sore throat is bacterial infection. Sore throat is caused by beta hemolytic streptococcus, that is Streptococcus pyogenes. And after the attack of sore throat, after some incubation period or after some interval, your body produces some inflammatory reaction, or it is the immunologically mediated inflammatory reaction, and that results in this syndrome of rheumatic fever. That results in the syndrome of rheumatic fever. So there is a close relationship of sore throat and rheumatic fever. Rheumatic fever usually follows the attack of sore throat, but it is not because of bacterial infection. It is the immunologically mediated inflammatory response of your body. And in rheumatic fever, the targets are joints, heart, skin, CNS. These are your targets. So it is immunologically mediated inflammatory disease that follows group A streptococcus, sore throat infection affecting heart, skin, joint, CNS, and is common in children at the age of 5 to 15 years. This is not because of direct infection, but it is the inflammatory reaction of your body. And why this immunologically mediated inflammatory reaction occur? This occurs because of molecular mimicry or similarity between cell wall M protein of the infecting Streptococcus pyogen and your cardiac myosin and lamin. So antibodies are developed against various streptococcal infection. Whenever there is a sore throat infection, antibodies are developed in your body to fight with the infection. So antibodies are developed against various streptococcal antigen. Antibodies are developed various against streptococcal antigen, among which the important antigen is cell wall M protein. And these antibodies, they cross-react with your tissues. These antibodies cross-react with your tissues because of molecular mimicry or similarity. Because of molecular mimicry or similarity between that antigen and your tissue. So they specifically attack heart, CNS, the basal ganglion part of the CNS, skin, joints, mainly the synovial membrane, and that results in syndrome of rheumatic fever. Pathologically, there is fibroid degeneration, inflammatory reaction, inflammatory edema, infiltration of inflammatory cells. So actually there is pericarditis, arthritis, formation of nodules in subcutaneous tissue, and involvement of basal ganglion of the CNS. So we see one by one. In case of heart, it mainly manifests as pericarditis. Pericarditis means involving all three layers of the heart: endocardium, myocardium, pericardium. There is endocarditis, myocarditis, pericarditis. In case of myocarditis, there is formation of Aschoff nodules. Formation of Aschoff nodules in the myocardium. Then there is dry pericarditis, and in case of endocarditis, it mainly affects your cardiac walls and the surrounding endocardium. It mainly affects cardiac walls and the surrounding endocardium. The most commonly affected cardiac wall is mitral wall and then aortic wall. First mitral wall and then aortic wall. So mitral and aortic walls, these are the most two common walls involved. In case of endocarditis, it mainly involves cardiac walls and the surrounding neural endocardium. So there is endocarditis, myocarditis, pericarditis. As the name suggests, endocarditis, myocarditis, pericarditis means there is inflammatory reaction. They involve cardiac walls, means what happens? There is inflammation of the cardiac walls, inflammation of the surrounding endocardium. There is endocarditis, there is valvulitis. In acute phase, it is valvulitis. It is the inflammation of the cardiac walls, which results in destruction of your cardiac walls or damage to your cardiac walls. So in acute phases, there is destruction and damage to the cardiac walls. But as you know, it is the physiological process that any inflammation in the body is followed by fibrosis, and fibrosis is then followed by calcification. So healing always occurs by means of fibrosis in your body. If there is inflammation, there occurs later on healing, and healing is always occurs by means of fibrosis. So later there is fibrosis and then there is calcification. So in chronic phase, after this inflammatory acute inflammatory reaction, that's vulvulitis, in chronic phase what happens? There is fibrosis, there is calcification. And because of this healing process, fibrosis calcification, it results in narrowing of your lumen of the cardiac wall. That results in narrowing of the cardiac wall. So that is called as stenosis. Narrowing of mitral valve opening is called mitral stenosis. Narrowing of aortic valve opening is called aortic stenosis. So stenosis means narrowing of the opening of the mitral valve. So mitral stenosis, aortic stenosis. That means narrowing of the opening. So it is the sequelae that happens in chronic phase. It is the sequelae. In valvulitis, means in acute phase, when there is inflammation and when there is destruction and damage to the cardiac walls, it results in opposite to stenosis. If the cardiac walls are damaged and destroyed, it results in regurgitant lesion. Regurgitation means blood flows back from ventricle to atria. Normal in cardiac cycle, blood flow from left atria to left ventricle, from left ventricle to aorta. During systole, when your ventricle contracts, the mitral valve opening get closed. Mitral valve opening get closed to prevent the regurgitation of blood back into atria. This prevents the regurgitation or backward flow of the blood into from ventricle to atria. Your mitral valve get closed. But if there is damage to the mitral valve plate, there is destruction of the mitral valve cannot be closed properly. The opening cannot be closed properly. If mitral valve cannot be closed properly, that results in backward flow of the blood from ventricle to atria. That is called regurgitation of blood from ventricle to atria during ventricular systole. So in acute phase, there occurs mitral regurgitation. Acute rheumatic fever, attack of acute rheumatic fever, when there is carditis, results in mitral regurgitation. But after healing in chronic phase, it results in mitral stenosis. The mitral stenosis is the most common cardiac lesion or the sequelae of rheumatic fever. Mitral stenosis is the most common lesion. So sometimes mitral stenosis can be associated with mitral regurgitation. Both components can coexist. Stenosis as regurgitation. Both can coexist. Means MS with MR. Mitral stenosis with mitral regurgitation, and one of them is predominant. So this is about heart. Second, arthritis, involvement of the lap joint, mainly knee joint, ankle joint, elbow joint, wrist joint. The joint is swollen, red, tender, painful. It is a fleeting type migratory polyarthritis, means it involves one joint, resolution of that joint, then it attack another joint, means one by one. It affects the joints one by one. So it is called migratory type of polyarthritis. Knee joint is swollen, tender, the swelling get resolved in knee joint, then it attacks ankle joint. Resolution occur in ankle joint, then it attacks elbow joint. Means one by one. It attacks the joint one by one, so it is called migratory or fleeting type of polyarthritis. Commonly involved large joints. Occur 90% of joints are very tender, joints are very tender, but the resolution of inflammation or the healing occur without leaving any sequelae. Means without damaging your joint. The healing in arthritis occur without leaving behind any sequelae or any damage to your joint. So the damage to heart is more important in rheumatic fever. Damage to joint is very rare. There occurs resolution of this inflammatory process. There is no sequelae or there is no damage to joint. But the cardiac damage is very important in attack of rheumatic, and that is permanent. Third clinical feature, formation of subcutaneous nodules. These are nothing but painless, pea-sized, palpable nodules, mainly over the extensor surfaces of the joints, spine, scapula, and skull, and it is associated with strong seropositivity. always associated with carditis. So subcutaneous nodules. This is involvement of CNS, the basal ganglion part of CNS. Basal ganglion, the function of basal ganglion is to control voluntary movements. The function of basal ganglion is to control voluntary movement. If basal ganglion is affected, that means there is no control over the voluntary movements. There is no control. That means there occurs involuntary movements. These are repetitive, uncoordinated, jerking type of involuntary movements. That means it results in chorea. Involvement of basal ganglion part of CNS results in Sydenham's chorea. Chorea means repetitive, involuntary, jerky movements of limbs, mainly the limbs. See, this is called also Saint Vitus dance. This is also called as Saint Vitus dance. Jerky, repetitive, involuntary movements of limbs. That is chorea. So it is a late sequelae. It appears usually 6 to 12 weeks after the attack of rheumatic fever. 6 to 12 weeks after the attack of rheumatic fever. It is common in girls. It is very common in girls. Clinically, it manifests as clumsiness, means patient is confused, not able to coordinate the movements. Patient is confused and not able to coordinate the movement, dropping the things. That is called as clumsiness. Deterioration in handwriting because of loss of coordination. Then emotional liability and grimacing of face. Grimacing of face means some extreme gesture about pain, about disgust. That is called grimacing of fear, grimacing of the face. Look at this. This is called as grimacing of face. It is the extreme emotion like pain or disgust. So, clumsiness, deterioration of handwriting, emotional liability, grimacing of face, and these are the involuntary movements affecting the hands, limbs. It's called as Saint Vitus dance. So, chorea presented like this. Chorea presented like this. Clinical signs in chorea, jack in the box sign means patient is unable to keep the tongue in protruded position. Patient is unable to keep your tongue in protruded position. Patient taking tongue in, out. So that is called a jack in the box. There are tongue fasciculations, tongue is in, tongue is out. That is called a jack in the box sign. So is not able to maintain tongue in protruded position. Milking sign of hands means if you give your finger to hold, if you give your finger to hold to the patient, patient is not able to hold it continuously. Patient like this, decreasing the grip, increasing the grip, decreasing the grip, increasing the grip. It is called as milking sign of the hand. This is called as milking sign of hand. This is chorea. Then erythema marginatum. Erythema marginatum is nothing but a skin rash. It is a skin rash. It is non-itchy, serpiginous looking rash like this in the picture. Pale center and a red irregular margin. It is a type of rash over the skin. It is mainly seen on trunk and limbs and it is non-itchy. Pale center and a red irregular margin. Center is pale and the margin is red and irregular. That is erythema marginata. Skin rash. So clinically patient presented with joint pain, swelling, fever. Joint pain means arthritis and high grade fever. Clinically patient presented with arthritis and high grade fever. Then constitutional